Hello, everyone. This is the training video for the anterior nasal swab, or also known as the rapid swab. Okay. So just keep in mind your patient's going to come to your booth. They're going to be given a label, a specimen container, and this swab. Okay. For some clients, we will already have the label placed onto the tube. But if not, please verify that the patient's last name, first initial is correct and that their date of birth is correct, or have them write their date of birth, and then tell them what your station ID number is. Okay. Once they do that, take the specimen container and have them place the label as close to the cover of the tube as possible. Again, this was a specific request from lab. Okay, and it needs to go on horizontally. Have the patient see you do this, because just telling them, a lot of them will end up doing this. Okay, so once they do that, have them take off the cover. Tell them to make sure that the inside is facing up when they place it onto the table, and to place the specimen container onto the tube holder that should be in front of them. Or I like to tell them it's that plastic things with a lot of holes on it, okay? Okay. Once that's done, have them open up the package for the swab. It's gonna look like a Q-tip when it's the anterior nasal swab. So the thing to remember for the anterior nasal swab is it's only right here in the nose, and you need to swirl for 15 seconds. But keep in mind, it's not just swirl for 15. You got to really scrape and swirl for 15 seconds, okay? And count to them out loud. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So not that fast, but 15 seconds and a nice good scrape. So I like to have a Q-tip as a prop to have the person see them do this. I like to use a Q-tip. I've seen some people use their pen, and I mean, that's fine. Just make sure you clean it. But again, it's the scrape and the nostril, like that's right here, that we really get a good sample. So 15 seconds doing that. So once they do that, have them get the specimen container, drop the cotton swab into the solution that's in the tube, have them lift up just about an inch or so and have them swirl one direction 10 times. Okay, 8, 9, 10, drop into the solution again, pull the swab up and have them swirl the opposite direction 10 times. So 8, 9, 10. So once they do that, tell them kind of shake off all the liquid off of the cotton swab, place the tube into the tube holder. Now take the wrapper and have them place the swab into the wrapper. Okay. The reason why is because they're going to throw this into the trash. It's really a biohazard, but make sure you say trash can, because the word biohazard is a little scary for non-medical people. Okay, the reason why we put it back into the wrapper is because when you put this into the trash can and we lift up the plastic bag, this always pokes a hole into it. So we've eliminated that or fixed that problem by having you tell them to place the swab back into the wrapper. All right, so once that's done, have them take the tube. Now again, keep in mind, you do not put the swab inside the specimen container, okay? Have them place the cap on. Then they need to baton twirl back and forth 10 times. Okay, 8, 9, 10. And then instruct them, take this specimen, go ahead and follow the line to the exit, and someone at the end of the line will collect your sample. And that's it. That is how you do the anterior nasal swab or the rapid swab. Thank you.